Disclaimer: this video is for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment. Always consult your doctor or primary healthcare provider before starting, stopping, or altering any medication or treatment plan. Have you ever wondered why metformin is the first medicine doctors prescribe for type 2 diabetes? Is it really that effective? How does it lower blood sugar? What are its side effects? And what should you never take with it? In today's video, I'll explain metformin in the simplest way possible. By the end of this video, you'll understand its mechanism of action, side effects, drug interactions, dosing, and important precautions and contraindications, all in a way that's easy to remember. Welcome to Pharma Simplified, where complex pharmacology becomes simple. Let's get started. What is metformin? Metformin belongs to the biguanide class of medications. Therapeutically, it is an oral anti-hypoglycemic or antidiabetic drug. It is the first-line medication for most patients with type 2 diabetes mellitus because it effectively lowers blood sugar, has a low risk of causing hypoglycemia, does not usually cause weight gain, and is affordable. How does metformin work? Let's break it down into 3 simple actions. 1. It tells the liver to make less sugar. Normally, your liver produces glucose even when you're not eating. Metformin reduces this process, called hepatic gluconeogenesis, so less sugar enters your bloodstream. It does this by changing the liver's energy balance, which blocks the signals that normally tell the liver to produce more glucose. Think of it like turning down a sugar factory. 2. It helps your body use insulin better. In type 2 diabetes, insulin is present, but the body's cells don't respond well to it. Metformin improves insulin sensitivity. This allows muscles and fat cells to remove more glucose from the blood and use it for energy. Think of insulin as a key and the cells as locked doors. Metformin helps those doors open more easily. 3. It reduces sugar absorption from the intestine. Metformin decreases the amount of glucose absorbed from food. It also changes the metabolism inside the gut, which further helps lower blood sugar. Bonus effect: metformin increases the release of a hormone called GDF-15, which may reduce appetite and help with modest weight loss. Another important point is that metformin does not stimulate the pancreas to produce more insulin. That's why it rarely causes hypoglycemia when used alone. Quick review. Metformin lowers blood sugar by reducing glucose production by the liver, improving insulin sensitivity. Decreasing glucose absorption from the intestine, helping control appetite. And rarely causing hypoglycemia when used alone. Side effects of metformin. Let's divide them into common and rare side effects. Common side effects. These usually happen when treatment is first started. They include diarrhea, nausea, vomiting, stomach pain, gas and bloating, stomach pain, gas and bloating, loss of appetite, a metallic taste in the mouth. These symptoms often improve after a few days or weeks. Taking metformin with meals and increasing the dose gradually helps reduce stomach problems. Rare but serious side effects. Vitamin B12 deficiency. Long-term use can lower vitamin B12 levels. Patients may develop fatigue, weakness, tingling or numbness in the hands and feet. Periodic vitamin B12 monitoring may be recommended, especially with long-term therapy. Lactic acidosis. Although extremely rare, this is the most serious side effect. Warning signs include extreme weakness, difficulty breathing, severe muscle pain, cold skin, severe drowsiness. This is a medical emergency and requires immediate treatment. Drug interactions. Now, let's discuss the important drug interactions. 1. Drugs that increase the risk of low blood sugar. When metformin is combined with insulin, sulfonylureas such as glipizide, meglitinides, the risk of hypoglycemia increases. 2. Drugs that increase blood sugar. Some medicines reduce metformin's effectiveness, including prednisone and other corticosteroids, hydrochlorothiazide, olanzapine. Patients taking these medicines may need closer blood sugar monitoring. 3. Alcohol. Heavy or chronic alcohol intake greatly increases the risk of lactic acidosis. Patients should avoid excessive alcohol while taking metformin. 4. Topiramate. Topiramate can also increase the risk of lactic acidosis when combined with metformin. 5. Drugs that increase metformin levels. Certain medicines reduce the body's ability to remove metformin, including cimetidine, trimethoprim, dolutegravir. Higher metformin levels may increase the risk of side effects. 6. Iodinated contrast dye. Before CT scans or angiography using iodinated contrast, metformin may need to be temporarily stopped because contrast can reduce kidney function and increase the risk of metformin accumulation. Adult dose for type 2 diabetes. Immediate release tablets. Starting dose 500 milligrams twice daily or 850 milligrams once daily. Increase gradually every week or every 2 weeks depending on tolerance. Maintenance dose 2000 milligrams per Dalton Y in divided doses. Maximum dose 2550 milligrams per Dalton Y. Extended release tablets. Starting dose 500 to 1000 milligrams once daily with the evening meal. Increase by 500 milligrams each week if tolerated. Maximum dose 2000 mg/day. Patients taking immediate release tablets can usually switch to extended release using the same total daily dose up to 2000 milligrams daily. Important clinical pearls. Remember these high-yield exam points. Metformin is the first-line treatment for type 2 diabetes unless contraindicated. It lowers HbA1c by approximately 1 to 2%. It has a low risk of hypoglycemia. It is generally weight neutral or may cause modest weight loss. Always take immediate release tablets with meals to reduce stomach side effects. Increase the dose slowly for better tolerance. Extended release tablets should usually be taken with the evening meal. Contraindications and precautions. Do not use metformin in patients with severe kidney impairment, especially when the estimated glomerular filtration rate, EGFR, is less than 30 minutes L/min/1.73 square meters. Avoid use in significant liver disease because of the increased risk of lactic acidosis. If iodinated contrast is required in patients with reduced kidney function or certain high-risk conditions, metformin should be stopped before or at the time of the procedure and restarted only after kidney function has been reassessed, usually after 48 hours. Final summary. Let's quickly review. Metformin is a biguanide antidiabetic drug, is the first choice medication for type 2 diabetes. Lowers blood sugar by reducing liver glucose production, improving insulin sensitivity, and decreasing glucose absorption. Commonly causes stomach upset, but rarely causes hypoglycemia when used alone. Long-term use may cause vitamin B12 deficiency. The most serious rare complication is lactic acidosis. Should be avoided in severe kidney disease and used carefully around iodinated contrast procedures. If this video helped you understand metformin better, give it a thumbs up and share it with your friends or classmates. Now I have a question for you. Why does metformin rarely cause hypoglycemia when used alone? Write your answer in the comments below. I read every comment and I'd love to see your responses. If you're preparing for pharmacology exams or you're a healthcare professional looking for simple, high-yield explanations, don't forget to subscribe to Pharma Simplified and turn on the notification bell so you never miss our next video. Thank you so much for watching. Until next time, keep learning, keep growing, and remember, at Pharma Simplified, we make pharmacology simple.